So, without further ado, up, 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 and away we go. I'm really pleased to introduce Dr. Alex Price to talk about the impact of COVID-19 on gambling. It's, of course, COVID has affected every single aspect of every single person's daily lives. Um, and here to present is Dr. Alex Price. He's a senior researcher with the Center for the Advancement of Best Practices at the Responsible Gambling Council in Toronto, in Ontario. For nearly 6 years, he has actively led the research and evaluation projects in several areas, including gambling harm minimization, responsible gambling, and positive play. Prior to joining RGC, Dr. Price spent 10 years in the fields of public health and practice, including work with the Provincial Health Services Authority and the British Columbia Centre for Disease Control. Alex, welcome to the National Conference. Thank you so much for being here this afternoon.
So just to start off, I just wanted to kind of set the table, so to speak. I think we're all fairly aware. We can pretty much go anywhere in the world right now and be guaranteed to see some form of primary health impacts from the coronavirus. Secondary impacts in the form of social, mental health, economic, and political effects have also followed in its wake. The gambling community has not been an exception to this trend. So really what I want to achieve in this presentation is to unpack some of the key issues in the gambling field that have been brought on by the pandemic and demonstrate how the Responsible Gambling Council has leveraged research in this instance to adapt its programming and support our stakeholders. So in mid-March, on March 17th specifically, the government of Ontario declared a state of emergency due to COVID-19. So this declaration basically resulted in the closure of all recreational facilities, public parks, playgrounds, libraries, bars, dine-in restaurants, theaters, places of worship, and obviously land-based gaming venues. In terms of sort of RGC specific exposure, the thing to keep in mind for these sort of community outreach and public education programs is that they had recently been redesigned for enhanced sort of live engagement. So these are programs that would go out into the community, say for instance, to amateur sports events, to universities, to schools, secondary schools, and provide sort of live in-person interactive experiences. We also run Play Smart centers. So these are responsible gambling information centers that are present in, I think, over 70 casinos in Ontario. So again, this is a quite exposed environment. We knew we needed to change these programs, but we needed to know specific data points in order to make the most informed changes to these programs and have continued impact on the public and specific targeted populations. So we ran the survey at the end of March. We were able to collect responses from approximately 2,000 Ontarian gamblers 18 plus. So, simply put, we see about a 50-50 split males and females in the sample, and this is reflective of the sampling strategy that we employed. Similarly, we see kind of a negative skew towards age, with the majority of individuals sort of over the age of 45. Education was not an area that we weighted. So what we actually find in the sample is a slightly higher kind of level of educational attainment amongst our gamblers in the sample. Turning to gambling behaviors descriptively, we asked fairly early on, what the typical type of gambling involvement was in the past 12 months. For the most part, about 3/4 of our sample indicated that they predominantly play in person only. We asked individuals during the period of study whether they had signed up and played online. And we found that 54% of the sample indicated yes. We also asked these individuals whether COVID-19 emergency measures, isolation, lockdown had influenced their decision to gamble online, and about a third indicated that this was the case. Turning to online gambling, we see that, in the sample distribution, a significant majority of individuals were younger. 18 to 24s and 25 to 34s in particular were more active in online gambling during this period of time. We do know, however, and this will pop up later, that over 60% of online gamblers were also those individuals who had indicated they typically, in the past 12 months, only played online. So this could be casino play, it could be community gaming, it could be lottery. And this represented 43.3% of this population. Turning to financial impacts, again, background information, we can see here that, approximately 25% indicated that they had either lost their employment or had their work hours reduced. And exactly 50% indicated that to some degree, their household income had been negatively affected by COVID-19. Turning to mental health, we used two validated screeners, subscales of the DSM-4 for depression and for anxiety. And we see here about 12% experienced or are screened for moderately severe and severe depression, as well about 25% experiencing moderate and severe forms of anxiety. Substance use was a particularly interesting area. We can see here that on the left, alcohol use in the 6 weeks since the emergency measures were put in place, just under 70% indicated that they had consumed alcohol. And in the case of cannabis, about 16%. When we asked a follow-up question, whether during this 6-week period, the consumption of these substances had increased, we can see that there has been a substantial increase, 40% in the case of alcohol, percent in the case of cannabis. So this brings us to kind of the meat of the analysis. We can see here that males and younger adults were more likely to gamble online when we compared online gamblers during this 6-week period, as well as those who didn't engage in online gambling during this period. In addition, those with online experience or previous online experience, they were more likely to gamble during this period than, say, those who didn't have previous experience. And I think this is a fairly reasonable assumption. Online gamblers were more likely to have moderate and high-risk gambling status. We can see in the case of depression that those who gambled online were more likely to have sort of these elevated levels, but also perhaps conversely that non-online gamblers seem more likely not to have any issues with anxiety. In particular, the comparison between high-risk gamblers and those who are not high-risk gamblers. And we can see, at the beginning, a fairly consistent pattern with males and younger people being more likely to be at high risk for gambling problems. And now we see a much stronger association in mental health with those with elevated levels of anxiety and depression being more likely to be in the high-risk group. Again, also here, negative employment impact, as well as the influence of COVID-19 to make the decision to gamble online, were also associated with high-risk gambling. Gambling while intoxicated, I think, is very important to note. We saw a very strong association with high-risk gambling amongst those who also indicated that they gambled under the influence of alcohol and cannabis, and even more strongly so, those who endorsed risky gambling motives have the strongest indications of being in the high-risk group. The pattern that emerges basically when we look at these three motives, gambling because it helps when feeling nervous or depressed, to win back money lost gambling, as well as to earn income, not to win income, but to earn income. We see the pattern emerge whereby a very strong association with elevated anxiety and depression, financial impacts, such as reduced work hours, lost employment, negative impact on household income, as well as gambling while intoxicated, all flare out. we wanted to know what types of information people were interested in at this point of time, and also kind of how they wanted to receive or engage with it. And we can see here that learning about the odds of winning a particular game, strategies for keeping gambling fun, how to manage time and money spent gambling emerged as the top three categories of information and support that respondents at least were interested in. And further to this, you can see here that nearly 60%, a very strong majority of individuals indicated they wanted to engage in this type of information, responsible gambling information, online. We can see that, the lockdown measures in Ontario and the pandemic more broadly have impacted Ontarians in financial terms, mental health, substance use. There has been a substantial number of people who are gambling online during the lockdown. We find that online gamblers tend to be more likely younger, male, have higher relative problem gambling scores, and experience depression at higher rates or elevated levels of depression. High-risk online gamblers often experience comorbidities alongside sort of kind of gambling-specific metrics that we would be interested in. And also, as I just said, gamblers are interested in responsible gambling information, and they typically want to get engaged with it online or remotely. And just to kind of briefly, how does this research inform responsible gambling or responsible gambling council's programming and application? Well, obviously we've kind of transferred a lot of our programming to digital delivery, so websites, social media ads, local ad channels, mobile content, so on and so forth. Those kind of digital kiosks with games and biometric feedback. Obviously, we had to translate that into new online experiences, and those have rolled out through our community outreach and young adult programs. In addition to other supplementary information, such as a Plan Before You Play initiative, we're also kind of engaged in ethnocultural programming, particularly for Diwali and upcoming for Chinese New Year. We're in the young adult sense or context, we're also providing colleges with communication kits so that they can further the messaging that we would otherwise be doing on campus, as well as providing access to webinars, so on and so forth. And obviously our youth program. Our live performances haven't been able to kind of continue at this point in time. And so a lot of these have been digitized and placed online alongside new game experiences to kind of engage students in this material.
Yeah, thank you so much. I mean, that was phenomenal and really interesting, and a lot of takeaways there. So let's do this. Let's get to a couple of questions. Don Feeney wanted to know, just as a level setting, what is the legal status of online gambling in Ontario?
Yeah, good question. Online gambling at this moment in time is legal through the provincial operator, which is the Ontario Lottery and Gaming Corporation. There are rumors that the province is soon going to be opening up the province to other private operators. And I believe they're working out the kind of regulatory framework for how that is going to happen.
There was there were a couple of questions about how have you modified RGC programs, due to the pandemic, and specifically based on this research. I thought you did a great job of outlining that. But is there anything else that any other learnings or lessons you've taken away from how to lean back into prevention and responsible gambling?
Yeah, I mean, based on this research, I think it provided a stepping point or a jumping off point for some of the areas, particularly for our kind of broader spectrum programming. So the community outreach and the sort of public education, youth and school age children. More broadly, I would say, we are interested in, how we can target our campaigns, whether there are, vulnerable populations that require kind of additional programming sort of attention. We do see in the second wave results, significantly higher levels of sort of elevated gambling risk amongst South Asian and Southeast Asian communities. There's an emerging research around the cultural impacts amongst these communities on problem gambling, and it's something that's been looked at, briefly in the past within the province itself. And so that, I mean, to a certain degree, that kind of aligns with our emphasis this year on programming targeting Diwali, as well as Chinese New Year. The second wave results obviously will be informing the reopening of casinos, right? Because we're asking questions about people's perceptions and feelings about that. And this is of particular interest to those that run our PlaySmart centers.
Well, I think one of the things that's so helpful about this is that is just the fact that you're doing monitoring and surveillance. We talked yesterday and we're talking today about this public health model, but yeah, so we're doing very little of that monitoring and surveillance. There's a few states who are doing things. None of it was the kind of rapid research that you have, but
Mhm.
it's almost impossible to measure. It's almost impossible to address a problem if you're not even measuring it, and if you're not looking for change, and if you're so.
Keith, that's really bang on. Myself and a couple of colleagues at other institutions, both Gambling Research Exchange and the Victoria Responsible Gambling Foundation, are, I believe, about to publish a paper in Journal of Public Health that says exactly that. So we've reviewed basically the history of gambling and public health framework specifically, and then apply that to a public health model. And those two things that you mentioned, health assessment and disease surveillance, were the two things that were most critical, and also most critically missing
Yeah.
from the mix in the gambling field. I think it's well established that gambling problems represent a public health issue, and I think that this research here and other research kind of shows that gambling problems often don't occur on their own. There are often other comorbidities, and this sort of reflects the sort of the nuanced nature of this and other other health issues. But really, one of the kind of the biggest barriers to advancement in, say, programming and policy and so on and so forth is a lack of rigorous evidence. And so that's kind of what we're advocating for, is kind of a renewed emphasis on these types of activities. They're not necessarily immediately actionable, but they're the type of things that set up the most impactful initiatives, which are policy strategy, right? So.
Yep. Yeah. No, I mean, that's excellent. It's great food for thought. And again, congratulations on your research. Thank you so much for coming to present it with us. COVID-19 and its impacts are top of mind everywhere, but there's very few people that have taken the time to look, and these findings are incredibly important, especially as you say, the stuff about comorbidity or gambling while irresponsible gambling, I guess, if you will, from home. So anyway, again, it's great stuff. People can contact you through the information we have at the handouts tab. But again, thank you so much, Alex. Really, really appreciate it.
Thank you.